As the media throngs the coronavirus story, we see the impact of the virus on public health. But what does that mean? And how do we learn from the current pandemic for future viruses? The novel coronavirus COVID-19 outbreak has rapidly spread from its beginning in Wuhan, China. Currently, people have been infected on all continents. But what makes the new coronavirus so dangerous to humans is simply that it is novel, meaning it is new to humans. So we don't have any way to fight it. The virus isn't more powerful than other viruses, but when it enters the human body, we have no pre-existing defenses, or what we call antibodies, since our bodies don't immediately recognize it as a dangerous intruder. So is there a cure for this new coronavirus? The short answer is no. Experts are now testing both antiviral medications and vaccines, but it is unlikely that we will have a vaccine to prevent the COVID-19 for at least a year. That is because we need to make sure any vaccines are both safe and effective. Hence, performing all of those safety and efficiency checks may take up to a year. How can I avoid getting this coronavirus? The advice sounds simple, and you've heard it over and over again. But the experts all agree it is very important to wash your hands frequently, that is with soap and water, and that works best, and not to touch your face with unwashed hands. Contaminated hands are the #1 way that the virus is transmitted. You can get it from touching surfaces that has a virus on it, then touching your face. How can I protect my family? If you are sick, do not openly cough into the air. Cough into a tissue and throw that away. Or cough into your elbows, then wash your hands. In addition, if a family member is sick in your home, try to isolate them within the home. If you can't find them regular face masks, then the sick person can use that to prevent the droplets from being coughed out farther than they would otherwise, limiting their spread. Masks don't protect the general public from getting the virus, but they can help a sick person protect others. How can I get information that I can trust? Medical experts advise people to be wary of random information that they find online. There are a lot of stuff on social media now that may be out of date, inaccurate, or misleading. My suggestion for everyone is to get your recommendations from the CDC, which is the Center for Disease Control and Prevention, from the Ohio Department of Health. They will have the most factual, up-to-date information. Also, you can contact the BGSU Department of Public and Allied Health, and we can direct you to credible information. In closing, remember, social media has its place, but you want the latest evidence-based recommendations in this rapidly changing situation. So, go straight to the source. Thank you.